Hello everyone, my name is Sherifat Abdusalam. I have my badge on, no nail polish, proper attire. Today I'm here to perform NG tube insertion skill, and first thing I'm going to do is to verify the physician's order to make sure it aligns with the medication administration right. Once that is done, I'm going to gather my supply. For today, I have the mannequin head, which is going to serve as my patient. I have hand sanitizer for hand hygiene, a tape. I have a cup of water. I don't have straw, so I'm using a spoon. I have my hand gloves. I have the MSS basing. In that, I have the syringe. I have my pen. I have the water-based lubricating gel. And I have the safety pin. I also have the absorbent pad. I have the NG tube itself in a pack. Then I have this basin that is going to serve as the container that I'm going to place the NG tube in when it's out of the bag. Once I have my, and I also have some tape down for the taping of the tube once I do my ciphered process. The other thing that is missing here is a pH test strip, which I don't have, but I'll verbalize when I get there, and also a suction apparatus, which is supposed to be beside the patient at the time of insertion. Then I'm going to gather this supply, go into the patient's room, knock, knock, provide privacy, introduce myself to the patient. My name is Sherifat Abdusalam. I'm going to be your nurse today. Identify the patient's two ways. May I know your name, date of birth? Patient is Mr. Smith, date of birth verified. I also verify with the wristband. Then I'm going to explain the process. Mr. Smith, the doctor has ordered that we insert NG tube on you. The way this works is for your medication and feeding. We're not going to do it by mouth again. It's going to be through the tube. Do you have any questions for me? No question. Do you have any known allergy? No. Do you, can I go on with the process? Yes. Mr. Smith, along the line, I'm going to be asking you to move your head back when I want to start the process and forward in between. So once patient gives consent, I'm going to raise the bed to a comfortable position, raise the head of bed to a high Fowler or as the patient tolerates it. And then I'm going to now perform hand hygiene and wear my gloves. For this process as well, I'm going to have a pulse oximetry on the patient because during insertion it's going to be through the nostril. I want to measure the oxygen at any point in time. So once I've done that, patient is on high Fowler, I'm going to first assess the nostril to make sure we have the right place, the right near to insert the tube. So the first phase of that will be for me to check the nares and make sure there is no obstruction, no dry mucus. So I can send you order for me. Yes, it's clear, and the other side is clear. No dry mucus, no issues. And then the other one will be for me to have the patient hold the one nostril and breathe through the other. This way, I want to ensure I have the greater airflow side to insert the tube. Mr. Smith, can you press your nostril on one side down for me? One side done. Greater airflow on the right. Same thing on the left. And I'm using the right side because for the camera purpose, this is the closest that the instructor can see and everybody can also use for the assessment. So once that is done, we've established that I'm going to place the tube. I'm going to place the pad over the patient. And then I'm going to remove the tube. At this point, I'm going to have warm water in the basin. So what I'm going to do next is to measure. This is the xiphoid process. This way, I'm going to measure from the nostril to the hair lobe to the xiphoid, just to measure the length of the tube that will go into the patient's nose. Nostril, down to the hair lobe, and then down to the xiphoid. At this point, I have 55. Take my tape And then for the process proper, I'm going to take the lubricating gel and I'm going to make sure the tip of the tube is well lubricated because it's about to be inserted. Once that is done, I'm going to make sure I ask the patient to hyperextend again for me to insert the tube. All right, Mr. Smith, I'm about to start the process. Can you hyperextend for me to the back? Yes. So I'm going to go in gently. Once I meet the first obstruction, which is the back of the throat, the oropharynx, the patient usually have a gag reflex, and at that point, I'm going to hold the tube. I allow the patient to take a sip of water. At this point, I'm using the spoon and ask them to swallow slowly as I'm advancing in, and then I'll continue to advance about 2 to 4 inches more. Every time they do that, I'm going to do that. I'm going to keep advancing, give them a sip of water and advance. Along the line, if for any reason they cannot tolerate it, I have to remove the whole tubing and then start the process again. So at this point, I have gotten to the point where I've labeled. So for that, I'm going to hold. And then I'm going to get the rest of the tube out. I'm going to call for x-ray at this point in time, clamp the tube, clamp the rest of the tube and ask for x-ray because I want to ensure patency, that it's properly placed. So x-ray has come in, the tube is properly placed. At that point, I'm going to tape on the nose and make sure it's secured. I'm going to tape and make sure it's secured. So if, like I said, if there's any resistance, I will have removed it, but patient is fine, there is no issue. And then the rest of the tube, I'm going to tape on the patient. So at this point, the other thing that I'm going to do is to now unclamp this and then aspirate and take the stomach content out. Okay, and then I'm going to aspirate and I'm going to take about 10 cc out. This is the point, put that in the MS's basin. This is the point where I use the test strip and the pH test strip. And this is because we want to make sure that it meets the between 3.5 and 5 pH for the gastric content in the stomach. This has been verified okay, there is no issue. And at that point, I'm going to now connect the rest of the tube to the suction apparatus, which will be by the bed. And the way that works is to ensure that patency of the suction apparatus tube too. I want to make sure that it for every 2 hours we continue to check the potency and continue to confirm that it is still intact, it's well placed. Once this is done, the whole process has been completed. Mr. Smith, are you okay? Do you have any question? Are you comfortable? Once patient is comfortable, I'm going to just place this here. Once patient is comfortable, and this is also taped, I'm going to get the remaining of the supplies. I'm going to take it out of the way. And then I'm going to now place the bed lower, place the patient back in lower position, give them the call light, and then provide education. Education for this will be that the patient should ensure that they don't they don't move the head of the bed lower than 45 degrees so as not to have the risk of for aspiration, and also ensure that the patient does not move their head too much so that they don't have a misplacement. Even though this is well secured, we also don't want to risk pulling it forcefully. So if the patient is okay and that is done, I'm going to gather my supply. Like I mentioned, checking the patency of the suction apparatus will be done every two hours to ensure that the tubing, the whole NG tube is intact and is working well. Once that is done, I'm going to gather the used supply, perform another hand hygiene, and I'm going to document. What I am documenting now is the amount. I'm documenting the characteristics of the fluid. I'm documenting the pH test that I did, what it is. I'm documenting the time that I inserted the NG tube and how the patient tolerated the whole process. Thank you.